Welcome back to GMT. Now, do you suffer from back pain? You're not alone. In fact, more than 65 million Americans suffer from it each year. It's also one of the more common reasons people go to the doctor, and it's second only to headache as the most common neurological ailment in the U.S. However, treatment choices are limited. Here with some good news is Dr. Ryan Reeves of Spine Team Texas. He has news of a nationwide clinical study called Nu-Q. Dr. Reeves, how are you today?
I'm good, thank you, Amy.
Let's talk about this study and how it's a little bit different when it comes to cell-based therapies.
Well, it is different. It's a process called regenerative medicine. Regenerative medicine refers to replacing or regenerating abnormal disc tissue. As many people have heard of stem cells and treatment of degenerative condition, well, this can be done using other types of cell-based treatments, specifically cartilage cells in this case. As one of the next frontiers in medicine, regenerative treatment options are being developed to treat a variety of degenerative conditions, specifically spinal degeneration. And it's our hope that we're able to provide a safe, durable, less invasive treatment options in the function of tissue restoration.
That's fantastic. Sounds like a great option for those who've been suffering perhaps with pain for a long time. Okay, so what kind of issues would indicate this type of cell-based therapy?
Well, for a variety of reasons, the discs can break down, whether that's aging and or injury. The discs primarily are located between the bones and the spine, and their primary purpose is to act as shock absorbers. Over time, the collagen can break down, and this can become very painful.
Okay, so are there other qualifying factors to consider for someone for this study that the public should know?
Yes, there are. You must be 21 years of age.
Okay.
You must have a history of low back pain for 6 months that has not responded to conservative care.
Okay.
You must not have had a history of surgery to the back and be in relatively good health with the exception of having your back pain and not be excessively overweight.
Okay, so what should someone know that would qualify for this study? What can they anticipate in regard to Nu-Q?
Well, the clinical trial is sponsored by ISTO Technology. Nu-Q is an investigational regenerative treatment that contains young cells derived from donated knee cartilage. These cells are cultured in a laboratory where they're allowed to expand and grow into millions of cells. Those cells are then injected into symptomatic degenerative discs to allow the restoration of those discs. And if successful, Nu-Q may offer a viable alternative treatment to surgery.
That's exciting news. Okay, lots of possibilities there. So what is the traditional treatment for someone who has those symptoms of back pain and maybe now they qualify for Nu-Q?
Well, the traditional treatment for degenerative disc disease is classically spinal fusion. And in advanced degenerative cases, this may be the only viable option.
Okay.
But it is our hope that we're able to provide an effective, safe, durable, long-term treatment options for restoration of patients' pain and improvement in their quality of life.
The hope is that this could be a game changer for so
Absolutely.
many who have been suffering. Well, thank you, Dr. Reeves, so much for being here today with this really good information. Now, if you suffer from low back pain and are interested to see if you may qualify to participate in this unique low back pain study, call Spine Team Texas today. Here's the number, 888-512-3892. And Spine Team Texas has locations in South Lake, Rockwall, and a newly opened clinic in Fort Worth Alliance. So call 888-512-3892 or visit their website at spineteamtexas.com.